And the weather actually is one of the many things that can get in your way of catching your Z's. So if you don't get a good night's rest, is there a way to make up for it? Dr. Andrew Simon with the Bastyr Center here with some answers. And I guess big question is, can you really catch up on sleep if you have shorted yourself during the week?
Well, you can sure try. I mean, it doesn't hurt you to get more sleep when you can. It calms the nervous system, rests the body. But in general, you're often running on a sleep debt, and your body adapts quite a bit to that.
A lot of people seem to function, and you're working through this right now.
Mm-hmm.
Yeah.
Being a new dad, you mentioned, and I think all of us have done it. You work through 5-6 hours of sleep, and you do that for day after day after day. And you know, some people are like, "That's all I need. I can get by on that." Is that really true? Or are we just cheating ourselves?
Well, I mean, we cheat ourselves with coffee, other stimulants, things like that, to try to make us have a false sense of being awake. But you know, it has detrimental effects on your health: blood pressure, chronic pain. Diabetes, weight gain. I mean, I gained about 10 pounds during my residency just because I was so busy.
So maybe if you're younger, you can get away with it a little bit.
A little bit, yeah.
But you do pay for it, right, on sort of the other end of your life, correct?
Yeah, I mean, you think critically less at work, at school. You know, you might have a little bit of brain fog, things like that. So, you know, that can hurt you on that side of it from a financial perspective, as well as just the health consequences, yeah. I would think, too.
Obviously, a lot of people do several different things to try to get a better sleep. You've got the blackout blinds, you've got what's the word I'm thinking of, the noise.
The white noise.
The white noise that people get. And then you have sleep aids, and you've brought some in with you, and
yeah.
This runs the gamut, obviously.
Yeah. Well, as a naturopathic physician, you know, I use a bunch of different therapies to try to meet the patient where they're at. You know, sometimes there's always a time and a place, but, you know, sometimes I'll use teas. It can be as simple as that, creating a routine and ritual at night where you use an herbal tea with different herbs that help kind of calm the nervous system again. Maybe you're not getting good sleep because there's some pain, or you're an athlete, and that kind of keeps you up at night. So take a nice hot Epsom soak before going to bed. You know, getting the lights down, the blackout curtains, like you mentioned, all that kind of
Putting your devices away, your electronic devices. I'm horrible with that.
Yeah, I mean, I've got my watch, my phone, I've got everything all connected, and my wife always reminds me to turn that stuff off before going to bed.
Is the number one thing recognizing why you're getting a lack of sleep? You know, whether it's you can't put things at work away in your head, or you know, you're thinking about your to-do list.
Exactly, well, that's a great example. I mean, you know, you having a journal, writing those things down ahead of time, making a list before going to bed, so that way it's out of your head and into a book. Or you know, I teach people breathing exercises on the mind-body medicine shift at Bastyr. So.
Any other words of wisdom to help us get a few more Z's?
Know, much like raising a, you know, I have a 9-month-old infant right now. Routine is the key. You know, do the same thing every night, and then your body gets accustomed to that.
Right. Okay.
We'll try.
Yeah.
Easier said than done. It always is.
Oh.
But you know what? We'll take any advice we can get. Thank you so much.
Thanks, Doctor. Appreciate it.
Yep.